Hello, my name is Lisette. I'm Anna.
I'm Sheila.
And I'm Jessica.
And we're talking about quality improvement bedside reporting. So basically, what is bedside reporting? Bedside reporting is a component of nursing where an oncoming nurse will receive information regarding patient care from the nurse that is leaving. It needs to be done at bedside and be inclusive of the patient in order to be effective.
So the Valley Health System's nursing vision is to provide highly reliable care in a compassionate, progressive, and safe environment that enhances critical thinking and collaboration, nurtures and recognizes clinical expertise, utilizes evidence-based practice dedicated to improving patient care, and encourages ongoing professional growth, development, and education. So according to Jackie Leibowitz, who's the CNO and VP of VHS, she described the nursing vision in a training video that was provided for bedside reporting. It's just now getting rolled out here. They've had it for about a month now. She also explained that the goal of the VHS
Bless you. Thank you.
bedside reporting is to standardize communication, provide interactive communication, and decrease near-miss harm events.
So what's the problem? The problem is that without a lack of inconsistency and a standardized approach, we're basically leaving bedside reporting to the interpretation of whatever nurse is coming on and off the floor. If not done effectively, we're leaving a lot of unanswered questions to the patient's care, missing important information that needs to be relayed, and it could be a key aspect for the plan of the day. For example, imagine telling your oncoming nurse that the patient's NPO because they might have a procedure done later. The AHRQ did provide a bedside shift report checklist that mirrors very similar to what the Valley Health System has as IMAP. On the AHRQ, they have things that are important, and I think like standard to pretty much give like almost a fishbone of what needs to be done at least on every bedside reporting, which is introduction. Obviously, we want to know who's coming on and taking over care. We want to make sure we're giving an SBAR report. We want to make sure we're also doing a focused assessment, and we want to make sure that we're reviewing the plan with the patient, as well as identifying any patient family needs. We want to make it standardized because we want to take out the guesswork. We want to make sure that no matter what nurse comes on floating from one other floor, you know that that nurse is going to give you A, B, and C. Now, whether or not you have to talk about D, E, and F, then you can bring that up. But at least no matter what floor you're on, you know that on IMAP there are certain things that just are going to be hit every time. It also gives a patient a chance to participate in their care. They might even tell you what's a priority to them, and that's important as well. We want to utilize that board as well to make sure that we're not only telling them what the plan of the day is, but also incorporating their concerns in as well. And we also want to make sure we're actually doing that assessment. 4 eyes are better than 2. So maybe something that the nurse can be like, oh my gosh, I forgot this, but let me tell you, this is what I found, or this is what happened. It takes out a lot of the later, finding out later in your shift that something wasn't done. So we want to make sure we're cohesive, we're consistent, and hopefully with a standardized approach we could do that.
So the Valley Health System's patient experience best practice number 1 is bedside reporting. Utilizing the IMAP format for bedside report, each shift report should include introducing the bedside report that is about to occur. So you want to tell them what you're doing, why you're doing it, and that you want them involved. Managing up by introducing the nurse that's assuming care, making the patient feel comfortable and feel confident in their skills as well. You want to update the whiteboard at that time. You want to make sure that you got all that information, that the next time their pain medicine is available, that is huge for patients. So make sure that's on there as well. Assessing the patient, so the wounds, the drains, the tubes, the catheters, IVs, equipment, fall scores, and you can expand on that. But those are the things you really need to be making sure that you are hitting. And going over the plan of care and asking the patient if anything needs to be added or if they have any questions, because as they're listening, might be the first time they go, oh, I didn't even think about that. So you want to make sure and hit on that. In the little packs we have for you guys includes a bedside report that actually can go onto your badge.
Thank you.
data over a 2-week period on a total of 44 patient reports. 15 of the nurses followed the IMAP format completely. All of those were new to the nurse patients. On any that were just updates, that wasn't the case. They did in-room 93% of the time, so that's a pretty good rate that we're missing. We still need to catch that 7%, but that's pretty good for the fact that this is just now rolling out. They updated the whiteboard 68% of the time. Again, that was on new patients. They introduced the nurse, the patient, the families 93% of the time. And the assessment and plan of care was only done 50% of the time. So they were missing that. On new patients is when those were mainly done, and it was limited assessments when it was being done. It wasn't a full checking blinds, checking wounds, checking all that. It was a quick glance over and, oh, they're hooked up, okay, and walking out of the room.
So we did a literature review. For the literature review, we looked up 4 peer-reviewed articles and did a comparison of the current practices in place here at the Valley Health System to the evidence-based practice guidelines from the specific articles. We found that there were a lot of recurring points that were shared between the 2 guidelines. One of them is having a standardized tool. Having a standardized tool developed consistency, confidence, and overall nursing competence in improved patient care. As Lizette mentioned earlier, having a standardized tool to go off of gives everybody a basis and takes away the guesswork so that this same information is being relayed every time. A second recurring point was the promotion of patient safety and satisfaction. Upon their research with the qualitative reviews, there's a lot of feedback and confident in the ability of the nurses. Patients expressed that they felt a lot more comfortable, they felt involved in their care when nurses did bedside report. Another thing was, as Liza also touched on, is patients did feel like there was an increase in their satisfaction. They felt included in their care. The bedside report between the ongoing nurse and the nurse that they just had allowed them an opportunity to be a part of their care and add any feedback or concerns or ask questions at that time. So by implementing and using standardized tools, it helps the nurses be on the same page as well as ensuring that most of the care is prioritized first. But with these common points, there's also barriers that arise when doing bedside report. And some of the barriers that nurses felt was they felt that there was a lack of confidentiality. They were always worried that they would say something in front of the patients that the patients might not want the family members to know. Some nurses reported that they were kind of uncomfortable. They were uncomfortable doing report in front of the patients between the nurses. They felt that maybe permission should be asked for ahead of time. Another issue was time management. An issue with doing bedside report is that it takes a long time. So it's easier to just give them, well, there's nothing new. I just gave them meds and leave it at that. And just leave the rest of the updates for the oncoming nurse to look up in the charts. Another barrier to doing bedside report was accessing isolation patients. They feel that they can do most of the vital information first, but leave the plan of care to be discussed when in the patient's room. So they want to cover the most important stuff before they even gown up and have to be in the room. And the last potential barrier was anxiety. People experience anxiety over change. They don't like the idea of having to change their routine and how they approach the nurses and their oncoming shift.
Okay, so I'm gonna go over the recommendations. First, we're gonna pass out the brochures. And and management staff and patient family advisors to identify areas of improvement and to decide how to implement the nurse bedside shift report strategy and implementing and evaluating the nurse bedside shift report strategy. Recommendation to improve bedside shift report includes training nurses to assist with developing consistency, competence in the bedside shift report routine. Handoff reports should be standardized, structured, and in written form. Bedside shift report should be face-to-face, involve the patient and families to improve communication, and the team needs to also agree on the model of the handover, such as the style, form, content, and the appropriate needs of the specialty. So now I'm going to go over the tools for the bedside shift report strategy, the ones that we just handed out to you. So the first one, for this one, it's the bedside shift report training. That one we just passed around. This one contains PowerPoint slides and talking points to train nurses to conduct the bedside shift report and to help them understand how to engage the patient and family members in the process. And then we also have the checklist that Lizette went over. Nurses can write on this form during the bedside shift report, and these highlight the 6 elements required to complete the bedside shift report for the unit. And then we have the brochure. This is given to patients on the day of admission, but they can be given at any time. The handout explains what the bedside shift report is, what the patient and family or friends should expect, and what they need to do. And it should also accompany a verbal explanation from the bedside nurse. And the bedside shift report should be no more than 5 minutes. And this also talks about what they should do. So they should listen, speak up, ask questions if something is confusing. And the bedside shift report usually happens every day between 7 to 7:30 a.m. and 7 to 7:30 p.m. Now for evaluation, we want to assess the implementation intensely during the first 2 weeks, and then periodically, such as at 2 months and 4 months after the start date, to ensure that the implementation is consistent among the staff. And we also want to get feedback from the nurses, patients, and families by asking them how the bedside shift report could be improved, such as what worked well, what was critical for its success, how could the process or tools be changed or adapted to work on their unit, and or they could use feedback by using mechanisms already placed at the hospital, which includes patient and family focus groups, patient and family satisfaction surveys, and staff surveys. And then we want to share the feedback with the implementation team, problem solve, and adapt the bedside shift report as necessary. Using the feedback you receive, you would want to refine the process and tools before you implement them on the other units. So in conclusion, the bedside shift report is a critical time for the nurses, patients, clinicians, and hospital staff to improve the quality and safety of the hospital care, and having trained and competent nurses that implement the change and that provides positive patient feedback will reflect well on the hospital as well as the care that the hospital gives.
So all these tools that were handed out are off AHRQ, and they are customizable to the hospital individually. So you can go in, if you change your shift times for whatever reason, or your bedside report times, anything like that, you can actually go in and change that information and print them specific to your unit, your hospital, that kind of thing. So thank you for being here for our presentation, and we do, like we said, we have little goodie bags with the markers, so you have no excuse for not updating that whiteboard.